Hi, everyone. Good morning. Today, I'm joined by Dr. Todd Vento from Intermountain Healthcare to give our weekly COVID-19 update to the community. Dr. Vento, thanks so much for joining us.
Thanks for having me.
As always, I'm going to start with our case trends from yesterday. They are not today's numbers, they are yesterday's numbers, just so everyone is aware. But yesterday's daily case counts were reported at 1,885, which actually came down from the previous week by 280, but it was a holiday week, which we will get to. School-aged cases were at 436, and we unfortunately had 15 deaths reported. Our hospitalizations yesterday were at 582, which is up from 529 last Friday. Our 7-day average positive rate is also at 13.5%. Let's talk about capacity a little bit first, Todd. How are we doing? What do the hospitals look like right now as far as ICU capacity goes?
Yeah, I think, well, the numbers you mentioned right there speak for themselves. A couple of weeks ago, we were looking at, in the 400s, 300s in terms of total hospitalizations for COVID. We're at 580 plus, and that's been climbing. So just by those numbers alone, we're above our capacity for, in particular, ICU care throughout the systems. And this actually also goes for non-Intermountain systems. We have a nice daily, if not multiple times per day, discussions, communications, so that we can look at where capacities are, if we need to load level, transfer patients, et cetera. So we know this is sort of a consistent theme. More cases because of Delta and the transmissibility, therefore more hospitalizations, therefore more ICU capacity deficits. And that includes being on the utah.gov coronavirus site, being above the threshold, the ICU threshold capacity for some time now, if you also want to look at those numbers.
I want to talk a little bit too about demographics of people who are hospitalized, specifically what the difference is between where we were at this year and where we were at last year, as well as what the demographic differences are in those who are vaccinated and unvaccinated, just generally speaking.
And I've just lost the connection there. Can you hear me okay still?
Yes, I can. Did you hear my question? Do you need me to ask it again?
I think I got it. A comparison from this year, last year numbers. So the thing I think I would have people focus on is, we have pushed for vaccines, obviously, and we could only give it to certain people. So 16 and up, based on the Pfizer eligibility, or 18 and up on Moderna, and some of that's going to be changing. And we've then lowered it to 12 to 15. So as you would expect, we had a new variant that was more transmissible, has a higher viral load. So when you get near folks with Delta, it's a lot different than a year and a half ago. You can transmit much more easily. So we've seen more pediatric cases, which makes sense. But what we've also seen is in our facilities, a lowering of the overall age of our ICU cases, in particular in our severe illnesses, so that the numbers are about 20 years less in age compared to this time last year. And that also kind of makes sense from the concept of or perspective of vaccination as well, because we push for vaccination to our elderly patients and healthcare workers, immunocompromised up front, with the goal that we would prevent them from being hospitalized. So naturally, actually, what we saw was an increase in the younger patients in our hospitals. We're still seeing that, and we have patients who have fewer comorbidities than they did last year. So we might see a patient who, say, is 40 to 50 instead of, say, 60 to 70, and that 40 to 50-year-old might have, say, obesity as a risk factor, or maybe hypertension, which is a little different than, I guess, a lot different than what we saw last year. And so some of that really gets back to really the vaccination and the effect of the vaccination on hospitalization and severe illness, which is it works wonderfully to prevent severe COVID infections, ICU hospitalizations, and death. And that's really what our big emphasis has been and will continue to be, is that the vaccine is really a tool that needs to be utilized in much higher numbers to prevent our current situation. And we need help from the public, the community, and everyone to push that message, is to get vaccinated so we don't have the situation in our hospitals.
I want to talk a little bit about pediatrics too. I know you're not a pediatric doctor, but the state has started to specifically report those school-aged cases, which I think is important because people are back in school. Has the cases increased since last year with pediatrics? What are those hospitalizations like right now?
Yeah, and It's a really important question because it really gets back to a couple things. One, it just concept of really simple math in a way. I know sometimes it might be hard to think of it this way, but it really is a simple concept. You have a virus that is more easily transmittable now. We know that Delta virus is much more contagious. And so if you don't have the barrier of vaccination to prevent the immunity of vaccination to prevent COVID Delta coming into you, if you don't have a mass barrier to prevent Delta from coming into you, then you're going to have more people who have Delta COVID cases. And there, by sheer number of more cases, there will be a percentage of them that actually have sicker cases, including in younger patients. And that's exactly what we're seeing in the pediatric population. Now, does that mean that the Delta is much more severe in children than, say, earlier variants, for example, original Wuhan or Alpha, Beta, Gamma, et cetera? And the answer is we don't fully know yet. But remember, it's just all about numbers. If you have a million more cases, for example, you're going to have a proportionate increase in the number or percentage of severe cases. And that's really what we're dealing with regard to the pediatric population. And so those numbers themselves have actually overwhelmed our children's hospitals, for example, primary children's, just by sheer volume of cases, which is why you see the emphasis on trying to prevent transmission in a population that can't be vaccinated yet. We're hoping that changes soon with the 5 to 12-year-olds in particular. And we expect that to come. But right now, that's why it's so important to actually decrease the risk of transmission in that population. And the way to do that is not just from preventing with our measures of distancing and masking, but also making sure that all family members in families where they have pediatric population get vaccinated. So we stop the likelihood of transmitting COVID within that family and to that child, and vice versa.
Yeah, I think those are really great advice to take, especially as we continue into the winter season, which typically has more illnesses, colds, flu, et cetera, coming. So great advice. And something on that too, Labor Day was around a week ago, 2 weeks ago. And typically we know last year we saw some spikes after Thanksgiving, after Christmas, this post-holiday spike. Have we seen anything yet from that related to Labor Day?
Yeah, it's a great question. We are trending increased cases overall. I know we've had a decrease on the 7-day average that you mentioned. Here's what I would tell folks to look at. Think about where we were after Labor Day 2020, and think about after Labor Day 2021. Our percent positive increased. Our virus has changed. It's much more transmissible, and you get a higher viral load, which is why you get sicker patients, because they get so much virus that the body has a hard time fighting it off, especially if it doesn't have vaccine, and especially if they didn't wear a mask, because there's more virus that comes in. So we were at 360 cases. I think our 7-day average, roughly mid to high 300s last year after Labor Day, and we steadily went up through December to about 4,000 or 5,000 cases. And this year we were at about 1,400 cases already after Labor Day. Then we popped, 4,000 after the weekend. We had 2,000 on a couple of days, but we were already at 1,360. So we were 360% higher in our cases after Labor Day this year than we were last year. And last year we went all the way up to 5,000. And you made a very good point. We've got schools back now, people crowding, more interaction indoor. We have less mask wearing for obvious reasons. We have less distancing. We do have the vaccine, which would help tremendously to prevent some of this. And what's coming around the corner? Flu season, respiratory virus season. And the difference this year is we are not masking much. And last year we had record lows, respiratory virus infections, influenza, parainfluenza, adenovirus. And so that's why it's so much more important for us to at least prevent the infections that we can prevent, and certainly prevent hospitalizations as well. So COVID vaccine, flu vaccine are going to be so critical this year. And honestly, as is the concept of masking, and in particular masking indoors. That's still critical regardless of vaccination status.
And I know some places are starting to give out the flu vaccine, and as Intermountain ramps that up, we will definitely be sure to let the public know when those are available. But yes, that season is coming. So that is good news for those for the flu specifically. I want to talk a little bit more about the COVID vaccine. There's this huge concept, or not concept, but conversation around natural immunity versus immunity from the vaccine. Can you just kind of give us an overview of what the differences are between the two and the pros, risks, benefits of maybe getting the virus, not knowing what's going to happen, versus getting the vaccine?
Yeah, I think it's a really important question. And then one thing I would caution folks up front is, again, when you approach anything with COVID, try to resist the temptation to do it as black and white or either or. It's and. So does natural immunity provide protection against COVID? Yes. Does vaccine provide protection against COVID? Yes. Some of the details we don't know yet in terms of what's going to happen over time. What we do know that individuals who have been infected and get the vaccine have a much more robust, brisk response to vaccination and even more durable immunity over time. And we're still trying to figure out, what do we think is the average general population individual going to expect out of, say, a COVID infection in terms of how long they will be protected against COVID versus a vaccinated person? We don't have all of those answers yet. We do know that in individuals who were infected, because we've had recent studies from outbreak through the CDC, outbreaks in Kentucky and Southeast states as well, that if you had COVID infection and you got a vaccination versus COVID infection and did not get a vaccination, you had about almost a 2.5 time decreased risk of getting reinfected if you were vaccinated. Okay, so what that shows you right there is that you do get immunity from having COVID infection, but it's not going to be enough to continue to protect you for, say, maybe future variants, for even reinfection of similar variants, as well as getting the vaccine after that. And that's why it's still important that even if you've been infected with COVID, you still get vaccinated at some time after your COVID infection. It's still critical. So that was my and. Both provide immunity, but it's clear that the vaccination will actually improve that immunity. And that's what we want. We want to have as many people in the community to have some level of immunity to decrease number of infections, decrease severity of infections, decrease the burden on our hospitals, burden on our ICUs, burden on our healthcare workers. And that is what the vaccine will help do, regardless of whether you had a COVID infection before.
I think it's important to note too that you don't know what's going to happen if you get COVID-19. It's affected people very differently. If you're healthy, it might affect you a lot more than you may think. So this risk or this gamble of, well, I'd rather just get natural immunity from the virus itself. I think that's important to note, that you don't know what is going to happen to your body or how you're going to react to getting the virus or exposing someone around you as well.
Yeah. I say, I thank you for saying it that way, man. And I would say we have seen that with Delta. And if you think about Delta in particular, how much virus people get when they get infected with Delta, it's so much higher. And that's where we've seen even healthy individuals who don't have any risk factors have the severe cases, end up in the ICU on a ventilator for extended period of time, and even deaths in healthy young patients. I mean, you see it on the news in many states, especially where there's a lot of virus circulating. And so I think that's the difference. This year, we have a virus that just really is much more aggressive in terms of how much virus you get when you get infected with it, but I will say that's where the vaccination can really help, because even if you get infected with Delta, which is not unexpected, we expect to have breakthrough cases. Remember, the studies were designed to prevent severe COVID and hospitalized COVID and deaths, ICU COVID, et cetera, and they work. They work very well as vaccines do that, and they've worked well against Delta. We don't know that your immunity necessarily from, say, last year's COVID infection will necessarily protect you against Delta this year, or Mu, or Lambda, or whatever next Greek letter alphabet variant comes forth. So get the vaccine. That's really the bottom line. We have clear data that it protects in so many ways for different reasons, and it's really one of the most important things we can do to try to get back to what we've always said, as normal or new normal as we can be.
So we're watching, obviously, what's happening in neighborhood states, specifically Idaho. We know what they're currently doing. Can you kind of explain where they're at in terms of care, and maybe how Utah is doing in comparison to that as well?
I think it's a critical topic to discuss. So as of yesterday, the state of Idaho went to what's called crisis standards of care throughout the state. So not just northern Idaho like it had been previously. The entire state is at crisis standards of care. And I'll talk about what that means in a second. Now, there's a direct correlation with the number of sick COVID patients in hospitals directly correlated with the percent vaccination of that state. You see it in Mississippi, Florida, Texas, et cetera. And so at one point, a couple of weeks ago, Mississippi, for example, had the lowest vaccination rate in the country, and they had no ICU beds. That's simple math. Vaccines prevent severe COVID, therefore they prevent ICU hospitalizations. And that was sort of one of those things you could have probably predicted. That's exactly what Idaho is seeing, because they have one of the lowest vaccination rates as well, among other practices in terms of social distancing, masking, et cetera. So Idaho had to go to crisis standards of care, which is a situation where instead of being able to provide the care for, say, the sickest person gets your care right now, so you save their lives, and you kind of triage the others to say, okay, well, that person can wait because I can take care of this person right now and make sure I save their life. Crisis standards of care mean you don't have the resources or the capabilities to provide the level of care that you would normally provide. So you now shift your focus on, I'm going to try to do the greatest good for the greatest number. And to do that, I need to focus on which patients are most likely to survive and they have a severe illness, and let's go and treat them first. And so that may mean if you're, say, 90 years old and have cancer and you come in with COVID versus you're, say, 60 years old and you don't have cancer, and maybe you have one risk factor for severe COVID, you both come in at the same time, and maybe, say, the 90-year-old with cancer is sicker, but they're not going to survive. The likelihood of survival is very, very low because COVID, in particular Delta, can be really, really severe. Then the hospital would be forced to then try to put as much of the resources to do the greatest good for the greatest number and save that person so that both individuals wouldn't necessarily die. And I hate to have to be that sort of specific or graphic about it, but that's really the concept, is you try to do the greatest good for the greatest number by prioritizing based on likelihood of survival. And really it's because you've gotten to the point, your hospital and your healthcare system was forced at that point. They never wanted to get to that point. They needed a lot of help from the community. So things that happen in the healthcare system and the hospitals are directly related to what happens in the community. If your community is not vaccinated, if your community doesn't distance, if your community doesn't wear masks, there are going to be more cases. It's going to overload the hospital. And, some folks don't like hearing that, but that's just the facts. And that's exactly what's happened in Idaho. And they've shifted to that. We are not in crisis standards of care. However, we certainly have plans to go to that level if we were forced to go to that level based on our resources and whether or not our resources could match the volume of patients, the volume of ICU patients, et cetera. So we are right now in what's called a deep contingency phase, if you will. And even that is not the optimal level of care. And I'll give you an example. A patient who, say, 2 years ago, when we only had 4% positivity and 200 cases in the community and our ICUs were wide open or not completely full, we might put a person who needs high flow oxygen in the ICU for close monitoring. Well, now that ICU may have all ventilated patients. So a person on high flow oxygen would have been in the ICU last year, goes to the ward, gets monitoring on the ward. Remember, now they may also not have, their nurse may be taking care of 5 other COVID patients, whereas maybe last year their nurse may have been taking care of 2 other COVID patients or 3 other COVID patients. That's what contingency care is. And it also includes things like load leveling, moving patients throughout hospitals, throughout the system, all healthcare systems, so that we can balance the load, so that we can make sure that we don't overwhelm 1, 2, 3 hospitals. So we are at that level, and we don't want to get to crisis standards of care. But, like I said, the correlation between percent vaccination in the community and ICUs being overrun and now crisis standards of care is very clear. And that's what happened in Idaho. And we would like to prevent that. So again, broken record, if individuals have this opportunity to think about risk benefit for themselves and protecting other members of the community, now's the time to get the vaccination. And that will help us prevent getting our ICUs overrun even more and going to a crisis standards of care, which we absolutely want to avoid.
Thanks for explaining that. I think that's super helpful to note, especially what the difference is and what could potentially happen. There's been a lot of discussion too from some areas about whether ICU capacity issues are accurate and real. What do you say about that? And why do you think some people in the healthcare profession are potentially leaving their roles?
Yeah, that's a tough question, not for the answer, but for the fact that we have to spend time trying to address people's fixation on whether this number is real or that number is real. Let me just tell you right now, our ICUs are over capacity. We're over capacity. That's on our numbers, that's on individual healthcare system numbers that are tracked, and that's also on the state numbers, which the state tracks. So there's really no other numbers that are being hidden. Those are the facts, okay? And I think what I would say is that if those are our realities, we have to deal with those realities. We can't make up a new reality and say, no, 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 it's actually this number, it's actually that number. And I'll say this because some folks may also not understand the fact that they say, well, there's this many beds. And again, we've talked about this before. You can have ventilators, you can have beds. That bed can sit in a room, and if I don't have a nurse, a respiratory tech, a physician, advanced practice provider, I can't take care of a patient. Therefore, that bed is worthless. You know, that patient who goes on that bed might as well be on their floor in the living room of their house because no one's going to take care of them. And so when we look at capacity, those are real numbers. Our ICUs have so much capacity based on a combination of beds, ventilators, staffing, types of staffing, et cetera. And those are the facts. They're not controversial. They're just the facts. And I think dealing with facts right now is really the most important thing. Is we are in a crisis. We are overburdened as a healthcare system. As you alluded to, we are losing healthcare workers for being fatigued, being demoralized, being tired of doing 18 to 20 months of the same thing and asking and begging and pleading for the same assistance from the community to try to help. Remember, it's not the health system and the community, it's the community, and the health system is part of the community, and we're all linked. Just like, if you don't believe it, we were linked to India and Africa and Asia. What's our prominent virus? Delta. 95% of our cases, probably even more now, are Delta. Where did that come from? India. If you don't think the world's connected, I don't know what to tell you. Delta came around the world very quick, and when you think about community and how to make things better, I would say to folks, think globally. Think what I do here will affect others. What others do will affect me. And so that's what we need to do. We need to be all on the same team and try to take the measures that will work to prevent spread of the vaccine and prevent, really, most importantly, a first step is to prevent severe infections and prevent the hospitals from being overwhelmed. I know I've gone on a little bit about this, but I think the last thing I'll say is if you're a nurse in the ICU or a respiratory therapist in the ICU, and you do 7 shifts in a row, and then someone says, hey, can you cover down on this shift because someone else is out, or someone else had to quit because they were very stressed about taking care of COVID. And then you go home and you have someone on the news, or you have your neighbor say, oh, those numbers aren't accurate. You guys aren't really overwhelmed. You can imagine how demoralizing that is. That's not being part of the solution. That's being part of the problem. And so I would ask, and I would tell you,
Todd, you might have frozen, or I might be
a lot of my
frozen.
colleagues, and
Oh, you're back.
called heroes. They just want people's assistance. They all know what we need to do, and really, okay.
Sorry, Todd, you cut out for the last second on your last point, which is really great. Do you mind saying that again?
Yeah. So I think, I was talking about, this concept of trying to act all together as a community. Okay. So we have healthcare system and we have the community. It's not separate. We're all part of the same thing, right? Just like the world is connected. COVID virus, respiratory viruses, they show that. It doesn't matter where you are. We're all on the same planet. The virus is going to jump around. It already has. Delta came from India. If you're a nurse in the ICU though right now, for example, and you've taken care of COVID patients straight, really sick in the ICU on ventilators for like multiple days in a row, and you come home and you hear folks saying, oh, it's not true, they have more capacity, they're not overwhelmed, that's being part of the problem. That's not being part of the solution. And what we need right now is solutions. And the solution is stop the number of COVID cases, stop the number of hospitalizations. To do that, you vaccinate, you mask, you prevent transmission, and that will prevent serious COVID cases. At a minimum, vaccinate. And so if you can get a vaccination, you will make an ICU nurse and any ICU worker or any hospital worker very happy, because they know that you're likely not to see them in the ICU in the next weeks or months or year. So that's what we need. We don't need people creating more problems and challenging or questioning what's happening. We're living it. We know it's happening. That's the truth. If you don't believe that, let us know. We'll try to find a way to show you that it's real, and then just accept that and then be the solution, which is to help spread the word about how to stop the transmission, which is getting a vaccination.
Thank you. I appreciate that. I want to talk about two more points really fast. So last week we announced that some surgeries are being postponed in Intermountain's healthcare system. Can you talk about which surgeries specifically, not the specific kinds, but the overall category of surgeries that are being postponed and why that decision was made?
Absolutely, and it really gets back to the previous point that our ICUs and our hospital beds are becoming overwhelmed, but our ICUs are over capacity. So if you have a surgery, for example, that some surgeries you get, and because there's such they work on important organ systems, so they're very complicated. You might need recovery that night or day or two or three in the ICU. And so in those situations, there are no ICU beds for us to bring in what's maybe considered an elective surgery, not an elective surgery that could wait maybe 2 months, but elective surgery that might be able to wait a week or two, et cetera. Then it would be unsafe for us to do that surgery if we can't then recover the person in the ICU. So those surgeries in particular have been postponed. I think we're around about 130 as of our decision to initiate the postponing of surgeries on 15th of September. And goal would be to try to maybe do that for a couple of weeks and see where we are, and really hope that we can make inroads in the communities to prevent the number of cases and prevent the number of hospitalizations.
On that note too, so our ICUs are full, surgeries are being canceled. What happens if you have an emergency or you need care, you need an ER, you need a doctor? What is your advice for people?
Yeah, so don't shy away from seeking care. It's really important. If you have an emergency issue, very acute medical clinical need, then you seek care, and we have emergency physicians and we have staff in the hospital to actually address your need. And we want folks to seek care. We do not want folks sitting at home with chest pain, shortness of breath. We have capability to address those. And remember, in this contingency care mode, we have some things with non-COVID that are being delayed, like the surgeries that we mentioned, et cetera. And we have the COVID folks who are in the ICU and on a ventilator, and obviously they're being taken care of. But that's where we have to be creative and say, can we do some hospital level care at home with daily nurse visits and tele-hospitalist rounding on them? Can we do remote patient monitoring? And so can we do more home health care, which we've actually done? But I will say, those are measures we've already taken. There's really no more measures we can take. But we're still being creative about how to move patients so that we can continue to be ready to take care of emergency and acute care needs. And so that's going to continue to be our priority, is taking care of folks who are, really very sick in the moment, need care immediately. Everyone in those situations should seek care.
And something on that note too, if you have a wellness checkup, if you have a normal clinic doctor's appointment, please go to them. Our clinics are still taking all of those appointments. So I think that's just important to note. If wellness appointments, yearly appointments are so important for your own health, and just figuring out if there's anything that your doctor needs to do with you. So just emphasizing that too, don't cancel those appointments. And if you have questions, you can always call your provider to find out if things have shifted at all as well. Todd, is there anything else you wanted to mention to us today before we take off?
Yeah, I mean, I'll sound like the broken record, but I think it's really important that, and I'll just preface it with, I was in the Army for 26 years and I was in combat zones. And I will say that if you know who the enemy is, our enemy as humans is the COVID virus. That's our only enemy. There are no more enemies. That's the only enemy. Everything we do to stop that enemy from causing problems to other humans is what we want to focus on. And so if it's vaccination to prevent COVID from being moved around in the community or causing someone to be really ill and even possibly dying of COVID, then we focus on those measures. Masks, distancing, limiting gatherings, still wearing masks indoors, even if you're vaccinated, because you can get, the Delta can overwhelm the vaccination. You'll have a less severe infection. But the point being is that we need to spend all of our energies as an entire community together, not just the healthcare system, at just focusing on that one single enemy as one team. So in a combat zone, if someone's firing at you, you know to fire right back. Like, that's where you fire. Okay, we need to fire at COVID. We can't fire at each other. So challenging whether or not folks are in the healthcare system are stating actual numbers, et cetera, that's not fighting the enemy. That's what we call friendly fire. What we'd rather have is fight the enemy. So we need everyone's help, leaders, individuals in the community, all citizens, to say, I'm going to do everything I can in my power to fight COVID, and that's it. That's being part of the solution, not being part of the problem. And as healthcare system, we need help. We need others' help to be part of this solution, or else this is going to continue. And we're forecasting more cases and more hospitalizations and needing more ICU beds. And we already don't have enough ICU beds. So we just need everyone to be on the same team, one community, one enemy. It's COVID. And let's all do the things to stop COVID from causing the problems that it's causing for us.
Dr. Vento, thank you so much for joining us. I really appreciate that. And for anyone listening, if you have not been vaccinated yet, you can go to intermountainhealthcare.org/COVID vaccine. We have a list of places you can get vaccinated through our system, or you can go to coronavirus.utah.gov. There's also state resources and places available there. Most pharmacies are giving out the vaccine at this point. It's easy. You can just walk in and request one. Again, Dr. Vento, thank you so much, and we'll talk to you later.
Thanks, Amanda.
Thanks.